I'm Dr. Archer Crosley, and today I wanted to talk about pediatric cardiology. Now, as many of you may know, a cardiologist is a heart doctor. So, what is a heart doctor, and why do I have to send to the heart doctor? Well, a heart doctor is really just a glorified plumber and electrician for the heart. Many things can go wrong with the heart. And in pediatric cardiology, a lot of times what we get are malformations of the heart. Your heart, when you are a fetus, is really just an elongated tube that goes through a series of folds to give you the heart that we all have. But many times in this folding, this development of the heart, things can go wrong. The valves and the vessels coming out of the heart don't always align the way that they're supposed to. And many times there's abnormal connections between the heart. Common ones would be a hole within the lower chambers, those would be the ventricles, and we call that a ventricular septal defect, and a hole in the upper chamber, those are the atria or the auricles. That's called an atrial septal defect. And the word septal just means wall. And so those are two common things that we see. Other things that we see are the pulmonary artery, and that leads from the right side of the heart into the lungs. That's what delivers blood to the heart. That at times can be choked off, and we'll call that a pulmonary stenosis. If it's coming from the left side of the heart, and it's the left side of the heart that sends blood to the aorta, and that goes to the peripheral parts of your body. That'd be like the muscles, the guts, all the other parts of the body, the brain. If that's choked off, we call that an aortic stenosis. So those are the common things that we'll see in babies. And oftentimes when you come into the office, I may only hear a heart murmur. A heart murmur is just an extra swishing sound in the heart. And if I hear that, I'm going to send you to the pediatric cardiologist. The pediatric cardiologist has a lot more training than I do in cardiology. They have about 3 years of extra training where they know how to listen to the heart sounds better, and they can take pictures of the heart, which we call echocardiograms, and many times they'll do an EKG too, and they'll put all that together and they'll see if they can determine what is going on with the heart, if anything. Now, fortunately, most of the time, it turns out to be a big nothing. It's just an innocent heart murmur. But when I'm listening to the heart, I can't always tell that. Many times, something that can be dramatically wrong with the heart will just present as an innocent heart murmur or a heart sound. So I'm going to send you to the cardiologist. And if I'm alarmed about something, well, I'm going to just admit the baby if I think there's something dramatically, seriously wrong. But if I think it's something innocent that can wait, we'll just make an appointment with a cardiologist. But that's basically what a cardiologist does. They just look at the heart, they do their echocardiogram, their EKG, they put all that together with their experience, and they try to develop a diagnosis to see if there's any abnormal connections in the heart. Now, we don't see many arrhythmias in pediatric cardiology. You see more arrhythmias in older people such as myself. You don't really see too many congenital malformations in older people. They have a whole different set of problems. But that's basically what's going on with pediatric cardiology. Okay, thanks for listening. I hope you'll subscribe.